The learning objective for Lesson 1 is to understand how assessing a series of case reports adds value to single case report assessment in the process of signal detection. In this module, we look at how we assess a series of case safety reports. In the first module, we laid the foundation by considering assessment of single case safety reports. Case series assessment builds on this foundation in preparation for signal detection. We will look at what information we can obtain from a case series that we can't find in individual reports. First, here is a reminder of the purpose of causality assessment, which is to answer the questions: did the drug cause the clinical event? Does the drug increase the risk of the clinical event? And therefore, how do we decrease the occurrence of this adverse reaction, or perhaps its severity, by early recognition of the symptoms? For this presentation, a case series is defined as a group of patients with similar exposure, the drug, and similar outcome, the suspected adverse drug reaction. The term drug refers to a medicine or a vaccine. There are problems with single case causality criteria. For example, plausible or reasonable timing. Was the onset of the clinical event after the drug was taken? And did the clinical event occur after an expected duration of drug use? A single report might not have the necessary dates. Also, we may not know the expected duration of drug use to onset. This is usually referred to as the time to onset. If we combine the information in case reports, we might start to see a consistent pattern of time to onset. We may or may not have D or re-challenge data in an individual report, but some reports in a case series might have this information. Excluding other causes is not easy from one report. For example, many people have diabetes or take statins, and it's not easy to determine from individual reports what role they might have played in the development of the clinical event. Were they alternative causes? Were they likely to have contributed? Assessment of a case series increases the possibility of finding drugs or clinical conditions that increase the risk of the suspect drug causing the clinical event. If a single report is for a condition that is a typical drug reaction, such as Stevens-Johnson syndrome or agranulocytosis, that adds strength to the report, but there is only a small list of these conditions. So, assessing a case series is likely to supply additional information that is missing or hard to assess in individual case reports. A logical analysis is applied that is a development from single case assessment. However, it is important to first carry out single case assessment of the reports in the case series. Many case series are identified through observations by the staff at National Pharmacovigilance Centres as they process reports, especially in smaller centres. However, if a case series has been highlighted through a statistical disproportionality method, then the clinical assessment of the single case reports and the case series is still essential to find out if there is a signal. Statistical disproportionality methods highlight case series for clinical assessment. They do not replace clinical causality assessment.